it shows. Hey everyone, and welcome back to the channel. Today, we're diving into a really important topic in men's health, one that often causes a lot of confusion and anxiety. We're going to talk about what's going on when you notice something unusual down there, specifically with your testicles. Is it a Varicocele, Testicular Torsion, Epididymitis, or something more serious, like a tumor? Knowing the differences is key, because while some of these are harmless, others are medical emergencies. So, let's break it down in a simple, clear way. And remember, this video is for educational purposes. If you're experiencing any of these symptoms, the most important thing you can do is see a doctor right away. First up, let's talk about hydrocele. The word hydro means water. And that's exactly what this is, a collection of fluid in the sac that surrounds the testicle. It might feel heavy, and you might notice it gets smaller when you lie down. In infants, these are super common and usually resolve on their own. In adults, they can happen after an injury or inflammation, but often the cause is unknown. The good news is, hydroceles are generally harmless. They don't affect fertility and aren't cancerous. If it becomes very large or uncomfortable, a doctor might suggest a simple procedure to drain the fluid. A quick way to help identify it, which a doctor might do, is by shining a light through the scrotum. With a hydrocele, the light will pass through, a technique called transillumination. Next on our list is a varicocele. If hydro means water, varico relates to veins. A varicocele is essentially a varicose vein, but in the scrotum. It's an enlargement of the veins within the pampiniform plexus, which is the network of veins that drains the testicles. These veins are supposed to have one-way valves to keep blood flowing up towards the heart. Slaps. When these valves fail, blood can pool, causing the veins to swell. This often happens on the left side due to the anatomy of the veins there. What does it feel like? Well, the classic description is a bag of worms. It might not cause any pain, but some men describe a dull, aching, or heavy feeling, especially after standing for a long time or at the end of the day. Unlike a hydrocele, a varicocele won't light up with a flashlight. Why is this one important? Because varicoceles are a leading cause of male infertility. The pooled blood can raise the temperature in the scrotum, which can affect sperm production and quality. If it's causing pain or fertility issues, there are surgical and non-surgical procedures to fix it. The word torsion means twisting. In this condition, the testicle literally twists around the spermatic cord, the structure that brings blood to it. When this happens, the blood supply is cut off. This is incredibly serious. The main symptom is sudden, severe pain in one testicle, which can radiate up into the groin and abdomen. Nausea and vomiting are also common because the pain is so intense. Unlike the other conditions we've discussed, this is not a wait-and-see situation. This is a go-to-the-emergency room immediately situation. And restore blood flow before permanent damage occurs, potentially leading to the loss of the testicle. The typical age for torsion is in teenagers and young men, but it can happen at any age. Do not ignore sudden, severe testicular pain. It's one of the biggest emergencies in urology. Okay, let's move on to epididymitis. The epididymis is a coiled tube that sits on the back of the testicle. Its job is to store and carry sperm. Itis means inflammation. So, epididymitis is the inflammation of this tube. What causes it? Most often, it's a bacterial infection. In younger, sexually active men, it's often caused by the same bacteria that cause ST, like chlamydia and gonorrhea. In older men, it might be related to a urinary tract infection or an enlarged prostate. The symptoms can sometimes be confused with torsion because there is pain and swelling. However, the pain from epididymitis usually comes on more gradually, over a day or two, rather than suddenly. 2. The back of the scrotum where the epididymis is located will be extremely tender to the touch. You might also have a fever, chills, or notice burning with urination. Treatment for this involves a course of antibiotics to clear the infection. It's crucial to finish the entire prescription, even if you start feeling better, to make sure the infection is completely gone. Finally, we need to discuss testicular tumors, or testicular cancer. This is the one that worries people the most, and for good reason. The most common sign of a testicular tumor is a lump or painless swelling in one of the testicles. It might feel like a hard pea or a marble. Sometimes there's a dull ache or a feeling of heaviness in the lower abdomen or scrotum, but often there's no pain at all. That's a key point. Unlike torsion or epididymitis, pain is often absent in the early stages. This is why regular self-exams are so important. By checking yourself monthly, you become familiar with what's normal for you, and you'll be more likely to notice a new lump or change. The good news about testicular cancer is that when it's caught early, it is one of the most treatable and curable types of cancer. The survival rates are incredibly high. But again, early detection is everything. Find a lump, hard spot, or any change in the size or shape of your testicle. Don't delay. See a doctor. They'll likely order an ultrasound, which is a very effective way to see if the lump is solid and needs further investigation. So, let's quickly recap the key differences. A hydrocele is a painless, fluid-filled sac that feels smooth and can be illuminated with light. Varicocele feels like a bag of worms, is usually painless or a dull ache, and can affect fertility. Testicular torsion is a sudden, severe, 10 out of 10 inches pain, a true medical emergency. Epididymitis is a more gradual pain and tenderness, often at the back of the testicle, and is usually caused by an infection. And a testicular tumor is most often a painless, hard lump you can feel on the testicle itself. The take-home message is this: get to know your own body. Perform monthly testicular self-exams in a warm shower. If you notice anything out of the ordinary, a lump, swelling, a weird shape, or pain, don't try to self-diagnose based on what you see online. Make an appointment with your doctor or a urologist. It's always better to be safe and get it checked out. Sharing this information can make a huge difference, so feel free to send this video to the men in your life. The reminder someone needs to take their health seriously. Thanks for watching, take care of yourselves, and we'll see you in the next video.